and those on this side of the world. It's the official starting time, and so I would like to respect the time, and thanks for those that have already joined. We may have a few more joining as the presentation starts, but I have the honor to introduce Nigel Poole, and he's currently Professor Emeritus of the International Development Policy in the Center of Development, Environment and Policy, CeDEP, in the SOAS University of London. And some of you have already interacted with him, and because he's been a visiting fellow with CIMMYT for nearly the last year. He started around a little bit later, around this time last year. Unfortunately, the COVID-19 flew through, which kind of limited our face-to-face interactions, but he was able to travel at least once to Mexico and also interact with some of the staff there. And we have been collaborating virtually on looking at some of the implications for nutrition, the agri-nutrition research agenda for CIMMYT. And that builds on a lot of earlier work that he has been engaged in terms of agri-nutrition work, including work in Afghanistan and other places linked to UK AID-LANSA. But today he will specifically present some of the findings also that were published recently in a paper, or a paper that's currently in press. It's already available online. And so he'll be talking about beyond the micronutrient paradigm. But without further ado, I would like to hand over to Nigel. And so he will be going through his presentation, and then at the end we'll have a question and answer. So please, if you have specific questions, already start posing them in the chat box, and we'll be taking them as many as time allows before the hour. So without further ado, I would like to hand over to Nigel and his presentation. Nigel, the floor is yours.
Thank you, Olaf. So we're sharing the screen. Good morning, good afternoon, good evening, everyone. Welcome to anyone joining remotely and at a later date. It's a pleasure to be here. Thank you for that introduction, Olaf. And I'm delighted to be able to make a presentation of the work we have done to date on developing a food and nutrition and health strategy for CIMMYT. As Olaf said, due to the pandemic, the process hasn't been as collaborative as we would have liked, but this webinar will help the task force share ideas, stimulate discussion, and get some reactions in order to refine our thinking and finalize recommendations. Let me just go to the presentation. I hope that's become clear to you all.
It's okay, thanks.
So many immediate responses to COVID-19 have shown how current pandemic conditions have exacerbated what we think are the present weaknesses of the global food system. These in turn are seriously challenged by the worsening impacts of climate change, and the consequences of these global short-term, medium-term, long-term crises are becoming increasingly intertwined, mixed up together. And moreover, as the CGIAR system and the structure and the strategies are being reconsidered, we think it's timely to analyze further, think through the issues about what more maize and wheat can contribute to food security, nutrition, and health. The outline of what I want to present is here. I'm a socioeconomist, at least I was a scientist once upon a time, but that was a rather long time ago. But looking at the subject of agri-nutrition research more from a social science perspective, our work is generally oriented towards food policies and policy makers. So this isn't science so much, although it does have some science in it. What I want to do is set out the state of the global food security, nutrition and health at the current time around the world, and comment on what I call the micronutrient paradigm. I want to reconsider the role of agri-nutrition research and the nature of that research, and the cereal's contribution to nutritious diets. We want to share some ideas on a new cereal food systems graphic we've developed partly among the team working on this, but also with CIMMYT graphic designers. Then I want to have a slight pause because we conducted a small interview, small-scale survey of staff in CIMMYT, and want to present some ideas of colleagues on the areas of nutrition and health and the work being conducted. There'll be conclusions and also time for questions. So, much of the thinking, although not all of it, has been already published, as Olaf mentioned, in this article in the journal Food Policy, Agri-Nutrition Research, Revisiting the Contribution of Maize and Wheat to Human Nutrition and Health. So that's available and it's already publicized by CIMMYT, as you can see in the bottom right of the screen. In considering the state of food security and nutrition in the world, I think we're very much dependent on a principal publication from the FAO and some of the other United Nations organizations, an annual publication that reviews the topic that it's highlighted. It seems that in 2019, there were still 690 million people who were hungry, and estimated also at the time of writing the current pandemic may add, 82 to 133 million to that number. So that's an awful lot of people who are still hungry. In greater detail, there are 144 million children under the age of 5 who currently suffer from stunting, which is primarily due to micronutrient deficiencies and a lack of adequate diet. At the same time, 38 million children are overweight around the world, with rapidly increasing numbers of overweight amongst children. Not only overweight amongst children, but adult obesity is also increasing at very, very high rates. And you can see the rate of increase estimated from 2012 to 2025. What we can conclude is that the Sustainable Development Goals, or Goal 2, and particularly zero hunger, those targets, there are 2 targets there, are not going to be met by the year 2030. And moreover, by 2030, the number of hungry people will exceed 840 million, which is going to be about 10% of the global population, despite all the efforts that are going into tackling malnutrition. And what's increasingly clear is the healthy diets that would contribute to people's well-being, better health, are unaffordable for many people in all regions of the globe, and that includes my own country, the UK, down to the poorest in sub-Saharan Africa. Talking of nutrition, people refer to the triple burden, which has these 3 elements. Hunger is basic undernutrition, essentially lack of energy. Micronutrient deficiencies are often referred to as hidden hunger, and it is those conditions which cause or lack of dietary diversity, which cause stunting with huge social and economic costs. The impact on those children that I mentioned are much restricted development in terms of social, physical, intellectual behavior, and the costs of treating that in terms of health and the loss of economic benefits are huge. We're talking of trillions of dollars each year. And I've already highlighted problems of overweight and obesity. That's the 3rd element of the triple burden, and that it is concurrent with undernutrition and micronutrient deficiencies is something we've discussed recently, and it's adult obesity and child obesity that we're concerned with. Slightly separate, or categorized separately, is the question of non-communicable diseases, NCDs, and by this I mean cardiovascular diseases, diabetes, some cancers, and some respiratory diseases. It's the diet-related impacts of those diseases which concern us, particularly in terms of malnutrition. The cost of non-communicable diseases is also very, very significant around the world. There's a There's a high death rate around the world due to NCDs, which is 56.9 million deaths in 2016. And of those, 40 million were due to non-communicable diseases. The diet-related health costs linked to mortality and non-communicable diseases are estimated alone to be 1.3 trillion. So that's separate from the undernutrition and micronutrient deficiency diseases. Total nutrition costs. I read this report on Guatemala, which came out just recently. Read it yesterday or the day before. And just for Guatemala alone, over $8 billion was lost in the year 2018 to economic, social, and health-related impacts of undernutrition, and $4 billion loss was attributable to overweight and obesity. Countries cannot afford this. So a preferred strategy for tackling these issues of malnutrition, and particularly micronutrient deficiency diseases, is dietary diversity, which is defined in a recent significant publication as a diet containing those substances there. A rich diet comprises things like vegetables, fruits, whole grains, legumes, nuts, unsaturated oils, and a low intakes of some protein-rich foods, seafood and poultry, but reductions or low levels of consumption of red meat, processed meat, added sugar, and note the refined grains. That's where the cereals fit in. Low consumption of refined grains in these ideal, diverse, and healthy diets. It's quite clear that countries around the world will end up with different diets. Each country may have its own food-based dietary guidelines based on the locally available food, but very often national food-based dietary guidelines that are developed in relation to the foods locally available often lack important details about quantitative components of the diet and also individual nutrients and other aspects of the diet, which we'll come on to in a moment. In looking at these problems, not just from a socioeconomics perspective, but I'll take that point from the moment. The history of agriculture and nutrition has changed over time, and it began to become of interest in the 1950s and 1960s. So 70 years ago, 80 years ago, 60, 70, 80 years ago. But times change and the research emphases have shifted. Johnson, in a very interesting article, traced the paradigmatic changes in agriculture, health and nutrition. And it was he who coined this term micronutrient paradigm, estimating that from 2005, 2010, we are in an age in which concern about micronutrients is foremost in the diet. Another commentator, Rifkin, who's written more recently, talks about the narrow approaches to healthcare and nutrition, and he refers to this term microcosms, meaning that sort of disciplinary approaches are separate and narrow, i.e. siloed, and looking at health, often people fail to look at health as a medical problem and fail to view the issues in terms of the wider economic environment, the social and the political and the economic contexts. Question, is this where we are now? I think these issues, that the need of broader approaches to certainly nutrition, that it's not just a medical issue, it's to do with health, and it's to do with food, and it's to do with agriculture. I don't think there's much dispute about that now, but the current focus on child stunting and micronutrients highlights that as the principal concern of many researchers. I did my own research just a few weeks ago into recent publications in 3 journals in which I publish or would choose to publish, being Food Policy, up in the top right, World Development, bottom left, and Global Food Security, bottom right. This was a search of nutrition in these 3 journals in the last 5 years, actually up to beginning of September, to look at the terms for micronutrient, carbohydrate, and dietary fiber, and so on. I think it's clear to me that there's been there is a high level of interest in micronutrients at the moment, but that interest has been increasing quite a lot since 2015, and I would partly put that down to the Sustainable Development Goals. When you think that the blue column on the left in each of those graphics at the bottom and on the side, the blue figure for 2020 only takes us up to September, I think you'd have to conclude that there has been an even greater acceleration in publications on micronutrients than actually appears. So there's also been comparatively little work done on carbohydrates, dietary fiber, and even just the term fiber. So I think that makes the case that micronutrients are center stage, and for good reasons. Assessing the micronutrients in the diet is often done by researchers in my area using a food consumption score, which is a number constructed by attaching weightings to the actual foods reported by individuals and households consumed probably over a week's period. But the foods are represented in 12 categories, and they're quite broad. So starchy staples tend to be, or cereals and tubers and roots tend to be 1 or 2 categories. They're all grouped together, and all fruits are grouped together, and vegetables. And there's quite clearly there are differences in nutritional quality in different varieties and different categories. And I think it's rather a blunt tool. Certainly not all nutrients are considered as important, and there are important elements of the diet of foods that at the bottom I've called bioactive non-nutrient food components that aren't actually included at all. So in a sense, we're only capturing some of the nutrition and health benefits of foods, and anyway, all foods are being lumped together. So looking over cereals as a whole and seeing how they're treated, starchy staples are often considered to be the predominant source of carbohydrates and hence energy in the global diet. But we know that cereals, although they're perhaps low in proteins or some essential amino acids, that there's an important lipid content, fat content that has fat-soluble vitamins, and certainly affects aspects of the digestive system, for example, cholesterol absorption. We know that there are significant amounts of B vitamins and vitamin E precursors and so on. We know also that there are important other components, these ones that don't figure in the food consumption score, that some of which are phytochemicals, such as those listed there. And also the carbohydrate fractions are important, and they contain more than just energy. Carbohydrate matters, and that's one of the principal contributions of cereals to diets. I call this diagram Carbohydrates for Socioeconomists, because as I said, I'm not a scientist, or no longer a scientist, but from various sources, we've put together these ideas about what carbohydrates contribute to the diet. And over to the left, you can see the storage carbohydrates. And if you can see my mouse moving around, this is really the energy side. And this is really important. Energy matters. Energy stops people feeling hungry and gives them the power to work and to live comfortably. On the right, we see dietary fiber, and that's made up of different sorts of components, carbohydrate components in the diet, non-starch polysaccharides, resistant starch. And I have to say, this is somewhat simplistic, and it's also contested. Not even all the scientists agree in how to categorize things, but you can see that the different types of polysaccharides and starch break down into different chemical components, some of which on the left are implicated in cholesterol reduction and the controlling cardiovascular diseases. Some pass through the stomach, the small intestine, and are fermented in the large intestine by bacteria. And this is a really important function because it gives rise to short-chain fatty acids, particularly butyrate at the bottom, which has proven capacity to combat colorectal cancer. but the work of the bacteria in the large intestine is much broader than that, and it's a very significant contribution to nutrition, but particularly health aspects beyond nutrition. So what I'm saying is these elements of the diet are really important and understated. So looking at my world of agri-nutrition and the wider world of agriculture and nutrition, I think we can identify gaps, what I'm going to call disarticulations. Firstly, a lot of the research that I referred to in that diagram of the publications on nutrients just talk about zero hunger. That's the Sustainable Development Goal 2 and zero hunger. However, the non-communicable diseases and some of the other issues and benefits that derive from the consumption of carbohydrates and cereals are to do with non-communicable diseases, which appear in SDG 3, which is a good health and well-being, and has a few targets, but one of them is, as you can see there, target 3.4 is to reduce mortality from non-communicable diseases through the prevention and treatment and promotion of mental health and well-being. There's nothing there actually about agriculture and food. I think this is unfortunate, shall we say. I think this disarticulation of so-called health from hunger is also reflected to some extent in the CGIAR system. And I pose the question, how much of A for NH, that's Agriculture for Nutrition and Health, and Harvest Plus, is concerned with these other issues beyond micronutrients? I think there's a disarticulation also reflected in the United Nations system, because among the SDGs, SDG 2 on zero hunger is managed by the FAO, and I think SDG 3 on good health and well-being is managed by WHO. They live and work in Rome together, but this creates some sort of barrier between considering the two and together and the linkages, and it seems to me that there are opportunities there for wider research agenda. Particularly in relation then to the carbohydrate idea, and following up on that, I want to use the term sort of non-nutrient components of food. Using World Bank terminology, in fact, other components of food that are not technically nutrients also contribute to nutrition and health, and these are fiber and a lot of these other phytochemicals, and also probiotic bacteria and so on. There's dispute amongst, or differences of opinion, if not dispute, amongst nutritionists about whether these substances such as dietary fiber, are they nutrients, aren't they nutrients? Even nutritionists aren't actually agreed about that, but they are recognized to be important by the nutritional community, but also particularly biomedical researchers. And they're known, apart from the effects of fiber that I've referred to, these bioactive compounds have beneficial antioxidant, anti-carcinogenic, anti-inflammatory, and antimicrobial properties. Looks like they're going to save all the world's problems, but does it combat COVID? Who knows? But they are very significantly important in many aspects of human health. And important for us, the beneficial effects of the consumption of whole grain cereal foods on NCDs is attributable to these bioactive components of dietary fiber and the phytochemicals. So this is being recognized. It is recognized, but it's not widely recognized. But whole grain foods, through their impact on non-communicable diseases, have very significant effects on the health aspects of these that I've got in that middle bullet point. So moving on, we know quite a bit about dietary fiber already. There's physiology, there's biochemistry, there's metabolism. A lot is known, but there's still a lot to be learned about types of dietary fiber, the relationship between to different foods, and some of the impacts on the body. But just highlighting there in greater detail the links between dietary fiber and non-communicable diseases. I'll skip over the detail, but it really does matter. It really matters also because dietary fiber intakes almost throughout the world are below public health recommendations. Recommendations around the world, or many countries, have been increased during the past 2 or 3 or 4 years. And just commenting on the United Kingdom, where dietary fiber intakes are below recommendations, a number of reasons have been put forward to do with limited public interest in the matter, an important public perception that starchy carbohydrates are unhealthy foods, fruit and vegetables, which also contain fruit and fiber, are high cost relative to other foods, and high fiber foods are not always available, not always convenient. Some of them may spoil if it's associated with fresh food sources, so they're not easy to keep either. The manufacturing and advertising industry promotes competing foods that are more attractive often to consumers, and consumers themselves are unwilling to change behavior and their preferences for sweet, sticky foods, swapping them for refined grain products, using refined grain food products rather than whole grains is an important aspect of the nutrient transition that's going on. Sorry, I didn't mean to advance there, and I can't go back. But we need to recognize that there are also adverse effects of cereals. Firstly, we're reiterating that cereals are not junk foods as commonly perceived in many parts of the popular press, shall we say. There are proper concerns about the effect of cereals on health and nutrition. There is such a thing as wheat sensitivity. There are impacts on diabetes. There are concerns about a group of chemicals called FODMAPs. Ultra-processed foods, UPFs, are important and really do contribute. They're often based on cereal foods, but also definitely contribute to ill health. There are links between obesogenicity, that's the tendency for increases in weight and increases in obesity, can be linked to cereals and some components, and there are links to hyperglycemia and insulinemia and hence the diabetes. But a lot of this is also backed up only by social and celebrity media and popular health publications. So we have some work to do to separate the science from the spurious knowledge that is out there and influences a lot of people in terms of their food consumption and dietary habits. Okay, we've been working together with other people in CIMMYT, have been working on a graphic that tries to sum up the work of CIMMYT and also to insert a little bit more in terms of nutrition and health. So this is the latest version of the graphic, which may shape the work of CIMMYT going forward. And I've highlighted in red the things that are more closely rather than less linked to nutrition and health. We recognize that CIMMYT has a great part to play in the developing the quality of maize and wheat-based foods. We recognize perhaps that there's more work that can be done by engaging with business and government and civil society in terms of the options for making available to all people and not just poor people nutritious wheat and maize-based foods. But going around, putting this in terms of the context of a food system, the graphic grows as it goes around in a circle. So we move from the top left down through production issues, and that I think is where, here is where a lot of the varietal development is implied in here. I think perhaps we ought to have some red in this box, but the development of more nutritious varieties of maize and wheat should probably figure here. But we go down into the actual production, and grain nutrient quality appears in here. I've highlighted it in red as an important issue. Are there ways, and pose the question, there must be ways to improve the quality of the grains that we produce going forward. Onto the processing and manufacturing sector, we touch on issues that are really important because a lot of the food processing or cereals processing in the world actually strips out the important nutrients because people prefer refined grains products rather than whole grain products. A lot of the nutrient quality and the fiber is lost, and we need to stop the loss of those high quality nutrients from cereals and work with processing and manufacturing industries. There may be ways of working and creating capacities within businesses, create incentives to enhance the nutrient and the fiber content of what is produced, so there's less ultra processed food and more high quality nutrients. In terms of distribution and retail, there is quite a lot to be done in terms of marketing strategies and practices and creating more and better public education and awareness from children to adults, from knowledge of nutrition and health and dietary food choices, even to some better knowledge of nutrition and metabolism. And consumption issues really draw more attention to the preferences that understanding better the preferences of consumers for why they choose what foods they do, what would cause them to shift to more nutritious foods, with the intention of enhancing the overall food security and nutrition of global populations. So it's not advancing. Okay. We conducted a small survey, as I mentioned at the beginning, among CIMMYT staff scattered around the world in different regions, representing most of the programs in CIMMYT, and we like to convey our thanks to respondents. We were asking them about the work that they've conducted that's related to nutrition and health, where it's the primary focus, and also looked at publications to see where the extent to which among the research outputs of SOAS, research outputs of CIMMYT actually contain information and products in terms of nutrition and health. So 35% of the people said that they had conducted work on nutrition and health, but there wasn't a huge number of publications. 2020 to date, only 7 publications seem to have a direct link towards nutrition and health of human populations. Sorry, trying to advance again. In terms of ongoing work in nutrition and health-based projects, the areas that academic research type areas that people were working in were primarily agricultural production. This is rather a small type on the left, but agricultural production is the sort of work that was contributing to nutrition and health. Something on food security, a little bit on nutrition, and these other smaller areas were less significant. But it seems that the bulk of the work being done is to do with agricultural production at that early stage in the food systems cycle that I've just shown you. And of that, people expressed the opinion that the work should be done in terms of crop breeding, crop production. Those were the 2 most cited reasons or opinions where CIMMYT should focus its nutrition and health work. Interestingly, gender, consumer behavior, and the food preferences of consumers that I've highlighted also was scored fairly highly in this hierarchy of items. There were other areas that were less significant, but all of which CIMMYT could contribute in some way or another, but very much focused on agricultural production, breeding. So the reflections on the staff survey are these: that there is a small but perhaps growing number of outputs from CIMMYT related to nutrition and health, but overall it hasn't been a major focus. Most current engagements in the area and future interests are strong related to agricultural production, but as highlighted, there is a strong interest in the future work on understanding consumer behaviors and preferences. And of the rest, there were isolated but potentially strategic efforts to focus on processing and manufacturing, and engagement with industry, and perhaps with policymakers, perhaps with advocacy organizations. So we're left with some, out of the overall work that we're thinking of and out of this survey, we're left with some questions. Where do we best want to invest in the future? how we can best organize ourselves to work on nutrition and health. And a particularly important question, what are the resource implications in terms of finance, facilities, staffing, and collaborative skills? By that I mean collaboration with other external organizations, because CIMMYT is not the only player. How to do that, and how much will it all cost? Highlighting those areas for future research then, and adding my own ideas, I think we've got to keep up the good breeding work that CIMMYT has been doing. So that's, for me, fully understood and accepted. Adopting a food systems approach, branching out to link with other disciplines and other sectors in the food chain, from production through to consumption, is important. I pose the question, I would love to see the work actually stretching into at least collaboration with the biomedical sciences, so we can understand more about carbohydrates, dietary fiber, and how to breed for the components of carbohydrates that actually contribute particularly to better health. So whereas the graphic I showed talked about from seed to fork, I would love to see from seed to metabolism, but I think that's a very demanding choice that must be made within CIMMYT. So we need to do more research on the under-researched bioactive food components, especially dietary fiber. We recognize the need for more work on industrial processing and the nutritional products of food. We need to expand work in consumers, and this political economy aspect, which is something that may not be easily considered in primary science organizations such as CIMMYT, but engaging communication, advocacy, education, and behavior change means talking with industry people. It means talking with governments also. So summing up, whole grain cereals and maize, which are often considered to be not nutrient-rich foods, or considered not to be nutrient-rich foods, they are important sources of dietary energy, essential proteins and micronutrients and the other stuff. And if looking forward beyond the Sustainable Development Goals to 2050 and beyond, if we're really going to feed the world's population within planetary boundaries and the threats of climate change, current intakes of whole grain foods have to more than double. There are tricky issues such as overprocessing and loss of nutritional value, which we need to work on to make more of the existing nutrition potential, and recognize that both cereals and the other so-called nutrient-rich foods, they are indeed nutrient-rich foods, fruits and vegetables and nuts and pulses and so on, they are both important. It's not one or the other that must be the focus of attention. Both require additional research and resources looking towards 2030 and beyond, so attention for one should not replace the other. I want to just pause there for questions and discussion, and I'll hand back to you, Olaf. I think I'll stop sharing the screen and then I can follow what's going on. So I'm not sure what screen there will be, Olaf. Can you tell me?
Okay, thank you, Nigel. Thanks for your presentation. So if people have questions and answers, please pop them into the chat box. And so some have already emerged. And so that includes a question from Hans asking you about those numbers in terms of the hungry people and the inability to meet the zero hunger target, because the CG has just released a strategy that the number of poor people is dramatically reduced by 2030, at least by 500 million, and also CERES 2030 is going to reduce the number of hunger. So would you consider these extrapolations by the CG and others to be too optimistic, or are you too pessimistic in terms of not foreseeing that we will not be able to meet those targets?
I'm relying on the 2020 version of the State of the Food and Agriculture in the World, which comes out of the United Nations, sponsored by FAO, but it's with World Health Organization, it's with the World Food Program, and I think one or two other organizations collaborate in this annual production. And the figures I'm quoting are the ones that they've used. Now, there is interestingly a reduction. We used to talk widely, and the literature that I look at talks widely about 840 million. Year after year, we've said that there are 800 million, about more or less, of people who are hungry in the world. That figure was revised downwards in the summer, just a few months ago, when China recalculated their own poverty figures from 2000, and it was realized that that 800 million that had been quoted from the early part of this decade up to spring of this year, shall I say spring, March, April, May of this year, that 800 million figure was an overestimate, and it's been reduced to 690 million. Anyway, it's dropped because of recalculations from China. But the figures going forward, the projections from FAO suggest that they very clearly suggest that we're not going to reach the 2030 targets, and will fall short by very significant hundreds of millions. So projections are always going to be subject to analysis, contradiction, I guess. But I haven't seen anything recently to say that we're actually going to hit the SDG targets. Maybe some SDG targets will be hit, but the bulk of the evidence now looks like things are going to be worse in 2030 than they are now, not just because of coronavirus, but impacts of climate change on agricultural production are likely to be negative as well. So I can't really comment on the projections from the CG system, except they're probably optimistic.
Okay, thanks. Martin has raised his hand. Martin, would you like to come in?
Yeah,
I assume it's on the same subject.
Yeah, no, basically also there's the big picture. And Nigel, I really appreciated your paper, and Olaf as well, and other people that are contributing to this. This is super important. I'm in all these discussions this week. I listened in at the World Food Prize meetings, and there are so many misconceptions, misunderstandings of what the situation is globally on nutrition. In my former university, we had a very strong nutrition group. And I had a lot of interactions with them. But what I see happening now is that, it's going completely in the wrong direction, because people think that we can solve the problem without cereals, for example. And then, so I put in the new strategy, the vision, it's still in there, which is basically design food systems that deliver affordable, sufficient, and healthy diets. And it's about diets. It's not about nutritious foods or whatever. Produced within planetary boundaries, and cereals are crucial in there. And in your presentation, you showed very important things. That one of the issues is that in the developed countries, we have over-processed foods with sugar additions, with all kind of other additions, making these products not as healthy as they should be. But basically, cereal products are very healthy when produced well. So we are working, it was, I think Gideon also said it in the chat, we are working with Vincenzo in the Netherlands, professor of food processing. So together also, how can we make the processing process so that basically we have products that consumers like, and at the same time more healthy? Because the problem is, and I'm making now videos of my grandchildren, when you give them something sweet, for example, they smile and they love it and those kind of things. When you give them something with vitamin A, that's not so tasty or whatever, you should look at that face. So the problem is also that we need to think about what consumers like. And what many people at high levels in all those programs at the World Food Prize are seeing around is basically what you see in the United States and in Europe. And in Mexico as well, by the way. We see that happening. So it's, I think, very important to communicate those stories about the nutrition, and also that we don't project what we see in Europe on the developing countries. Hans came in with the chat as well. We are in the CGIAR in the midst of this discussion. So let's also see that we communicate even more. I tweeted about your paper. Thank you for this. But that we can get this wider view, systems view, better in the minds of leadership in the big 3 organizations in Rome and in the CGIAR as well. Thank you so much for this presentation, and I will keep on thinking with you and Olaf Gideon and other people how to communicate it better and to get this on the agenda of the 1CGIR. Thank you so much.
Thank you, Martin. That's encouraging. Thank you.
Yeah, thanks, Martin. And indeed, Martin was also referring to one further addition by Hans on the overprocessing. So yeah, the consumption of refined flour products is much more a problem in high-income countries. Much of the wheat is consumed as whole grain in lower-income countries. But even there, the trend to consumption of refined flour products. So there should be, or he's advocating for a global campaign to explain benefits of whole grain products, and that needs to support from the processing industry. Jan de Bane also made a similar point, or emphasizing your point that there needs to be a big change in diets to away from refined carbohydrates, because that's where a big challenge is indeed, to see how can these diets be, well, often these refined products are based on cereals, and therefore the cereals get the bad press. I'm just scrolling through. So there was another comment from Hans, about that the industry needs to modify the way they produce bread. Extremely short mixing and fermentation times. Bread with longer fermentation time of more than 12 hours seems to cause less gluten sensitivity. Gluten is tough to digest. Gluten comes from glue, and longer fermentation time, increasing baking costs, could at least partly address the issue of gluten sensitivity. So there are some developments there that offer prospects. So just trying to see another comment on from Marcia. What consumers like is hugely influenced by corporate marketing, and that's indeed linking back to some of the points that you made in terms of the big vested interests and how that influences consumer decisions. There's a request if we could share the PowerPoint. I'm assuming there is no, I mean, most of the stuff is also reported in the article except for the survey results. And Abdu had a point of where CIMMYT has been working with the private sector, but facing the difficulty to make business case in seed production of nutritious maize wheat seed, as the focus is more on yield than on micronutrients, which is yield being more visible in terms of to the farmers and the beneficiaries. There's a number of congratulations to you in terms of both the presentation and the points being raised. And let me see. Kevin also raised a point on moving from processed to whole grain wheat and maize. Is this an issue for breeding or food processing or both? Maybe Nigel, would you like to comment on some of these comments made so far?
I think we've got to breed varieties, cereal varieties for better nutrient content. You're doing that, and I think we need to do it more. It's not my area of expertise, but I would love to think that we could work on more nutrients than just vitamin A and zinc and iron. Secondly, I do think that the food industry has a lot to answer for, but it's driven by consumer demand and profit. Just to sidestep, it's taken years and years and years, decades, to actually persuade people that smoking tobacco is injurious to health. And I think the way the tobacco industry behaved has been very shoddy, very bad for decades, and that's a serious problem. However, I think we've made big progress on that. I think in some respects, the food industry, with its determination to produce ultra-processed foods, is driven by the same sort of profit-driven agenda. Of course, it's driven by profit. It has to be, There's nothing wrong in that, but the profitability is probably associated with foods that are noxious to health rather than beneficial. I think there are real technical problems that need to be overcome in terms of milling. You suggest, or one of the comments talked about the baking, and I think there's more to be learnt on how to improve quality from the different stages in the industry, from milling to processing, and certainly the advertising and promotion of noxious foodstuffs really is something that could be handled by government, because the food industry is not going to respond to requests to change its business model. So I see that we in CIMMYT have to work in all these areas, from varietal development right through to food consumption. We need to understand, why people choose what they do, and food systems that can actually deliver appetizing whole grain foods to consumers. And if we didn't mill wheat and maize but ate whole grain, one of the colleagues told me that I consulted about these things, a scientist who worked on dietary fiber for 50 years. He said, we'd solve the world's nutrition problems if we stopped milling grains. Now it's probably not quite as simple as that. What other can I pick up on? Can I just pause there, Olaf? And if there are specific questions, if we can just bring them through. Yeah.
No, there were another couple of related comments, including from Dutyman, that biofortified varieties are only of interest to farmers if they also offer a yield advantage compared to the current varieties. So high nutrition values as such is not sufficient for uptake. So that's similar to an earlier point from Abdu. There's a question whether the doubling of the whole grain can be attributed to us. Well, in fact, we do cite a couple of studies in the paper that do actually give the full reference to the doubling. So Janet, please look at the paper, and otherwise I can point you to the exact two references. But yeah, we do summarize those, and so in principle there is evidence there. Gideon then also raised this issue of the current collaboration on industrial processing and nutritional quality with Wageningen that Martin also briefly touched on. And Gideon was also raising the question of where to invest and with what partner or with which strategic partners to partner with. So there's a couple of remaining areas there, but I think you may not be able to answer all of those right now, but we are raising some questions there that we would like to look into. Then, sorry, Iba also raised her hand, so let me, Iba, would you like to come in?
Yeah, well, just wanted to make a comment. First of all, Nigel, you did a great presentation, so great job, and I think that, these are the types of presentation and work that I think we need now. But I would like to comment on a couple of things. One is that, as you also mentioned, Nigel, at the end, yes, we can work on nutrition, and we should work on nutrition, the improvement of nutritional value of grains. But I think that, as you said, we have to check the effect that actually, the nutrients that have increased in the grain or that are naturally present in the grain have on human health. And for that, I think we'll need to work much more on collaborations, because I don't think that currently, CIMMYT has all the capacity to do that. Or maybe we'll need for sure more fundings, I believe. And another comment, I don't know if you want to comment on that.
I'd love to. As an external person, really, I would love a certain person and an observer of the CG system. It seems odd to me that we've got so many different centres that actually work on similar products. We ourselves in the Socioeconomics Program have talked about collaborating maybe with on rice with IRI, There are other CG centres that also work on cereals, and a lot of what I've said about maize and wheat applies to perhaps rice and other the minor cereals, sorghums and millets and others. And in an era when there are always a threat of reducing resources, or at least greater economies are being required of us, it seems to me logical that such organizations should get together and collaborate more. Yes, I'm aware that I'm impressed and I've learnt a lot from the scientific capacity of the cereal scientists in CIMMYT. Thank you, Itria, and Natalia, for what you've taught me. But I realize that you're not huge units, and there are limited resources. That green line at the end of those thoughts, at the end of the survey, were partly to do with you. But there are other organizations also. It's not just the CG Centre. There certainly are other organizations around the world that are working in these sorts of things. I guess greater collaboration, it does require effort. It requires people who can do it, because not all people can get on with people in other organizations. It requires some interpersonal skills and collaborative skills, as well as bringing the technical knowledge together. And that requires quite a lot of effort and a commitment to bring organizations together, either in programs or institutionally, to bring about mergers. It's beyond my brief to redesign the CG system and also to work out how to relate with other national and international organizations that have huge expertise in these things. But there seems to be potential. Industry has far more resources about these things, and if only one could work towards leveraging resources from food industries, they're mega corporations, and then if we could tap into those somehow and leverage their resources, then I think that would help help us overcome some of the problems. I'm more optimistic than realistic, probably. So very happy for people to say, it just won't work. Well, no, I'm not happy for people to say that, but we've got to try, and we've got to find ways of collaborating and looking for particularly economic efficiencies in terms of research program.
Thank you. Can I have one other comment, like brief for time? Well,
quickly, because we're running out of time, and there's a couple of others, so go ahead.
So, and one more point is we all are agreeing that we should consume more whole grain. And so from that point, I think from a strategic point of view, there is a whole grain council with a lot of scientists, cereal chemists that are focused on advertising the nutritional value of whole grains. So I think we should approach them. And also on the other side, I do not agree with some of your comments saying that grain processing is like ruining the nutritional values of grain, because yes, it's diminishing like the nutritional values by taking out some parts of the grain, but still I think we have to keep pushing, saying that the grain, even if it's refined, has nutritional value. So it's not deleterious for your health or bad. So I mean, these are just 2 points, and I think
Thank you. Just maybe quickly, there's a couple of other points that came in. Natalia, also on the processing challenges, the technological challenges to use whole grain and make it profitable for the industry. So the need to work together with breeders, food scientists, and nutritionists becomes more relevant. Ravi also made the point that we haven't really touched in the presentation, that if we go through the processing industry, minerals and vitamins can be added. So the addition of those, so maybe then that can supplement any breeding efforts, or maybe there's no specific need for biofortification in that aspect. So our focus is small-scale farmers and consumers who consume the food locally. And then there was also another comment from Janet on the whole food waste becoming a big topic. And so as we are looking at refining some of these whole grains, what are some of the implications for the material? We are approaching the end. Hans had another point and also raised his hand. Maybe Hans, would you like to elaborate orally? unmute.
Okay. Well, thank you, Olaf. I mean, I wanted to make, I mean, first of all, Nigel, this was a fantastic presentation, really. I mean, I enjoyed it very much. The point I wanted to make in this whole area of whole grain, there are still so many questions, and I would argue that we are still in the infancy of understanding what makes a good whole grain bread. But we need to get the industry, the processing industry in it. When I was attending the Global Miller meeting a few years ago, I gave a talk. It was frightening how disconnected the millers were from breeding. For millers, grain starts when it comes to their elevator, and that's it. They really do not talk very much with breeders. And secondly, I was also surprised how little interest there is in the public side. Peter Sherry and the famous professor from Rotterdam, I forgot his name, they were leading a proposal to do a really huge study from field to fork and looking at all the components which influence the taste and smell and the processing quality of wheat. Unfortunately, that was not funded, and that study is still out because we don't understand what makes a good and bad wheat. And what I wanted to point, and this is really important for if we go out, there was really a study in the University of Hohenheim. They went together with a baker and they analyzed more than 100 modern varieties and land races. And their conclusion was everybody can smell and taste the difference between a good wheat and the bad wheat. But what was very important is that they had the same number of good and bad smelling wheat among modern varieties than they had among land races. That would indicate to me we have never really selected for this. It was never considered, but we would have variation to improve. But that would require that the breeders and the processing industry come together, and also that our Ministry of Health, etc., that they really promote and go out with whole grain products. And I always said maybe the best thing what we need is a couple of celebrities from India, from Hollywood, who say, okay, whole grain bread is good for you, because I think that will have a bigger impact than many of the scientific campaigns we try to influence people. Thank you.
Okay, thanks.
I'll make one
Thank
last
you,
comment,
Hans.
Olaf, please.
Okay, Nigel, you want a final comment? Because then we need to be wrapping up.
I've spent most of my life working with small-scale farmers and tackling rural poverty, and I'm committed to them and have been for more decades than I care to remember. But when one looks at the problems of nutrition, being not just hunger, but micronutrient deficiency diseases and overweight and obesity, the scale of the nutrition and health problems is global, and it's probably the rich people are as badly nourished as poor people. We mustn't focus only on agricultural production and farmers who are growing our crops. We have to consider that there are 8 billion other people who are concerned, who eat the products that we're concerned with, and the scale of ill health is global. It's not just to do with production levels. So the nutrition and health agenda has to take us to consider the whole global population.
Okay, thank you so much, Nigel, and thank you so much to everyone who participated. I counted at a certain moment we had 66 people calling in, so that's you had a good interest in also hearing the questions and answers. There was a lot of both praise for your presentation, but also seemingly a lot of interest to see how we can take this forward. So, as Nigel mentioned, originally we started off with a nutrition task force that has been looking at some of the implications that comes out of the previous Science Week, and then we had Nigel come in as a visiting fellow to help us out, think through and put things on paper. So there's a more detailed document also coming to support the strategy development. It's not a full-fledged strategy, but it provides a number of elements. And so we definitely welcome to continue this discussion with those that are interested and see how we can take it forward. Nigel was working, or is still for a few weeks working part-time for us as a visiting fellow. So also, although he's sitting in the UK, he is potentially accessible. So if you have particularly interest to follow up on certain aspects, then don't hesitate to do so. I think he's more than willing to entertain I mean, he's actually looking for interest from our side to see how we can better engage and better develop that strategy.
I would love that, Olaf, and I'm very happy to make the presentation available. I'll send it to you.
Okay, so thank you so much. And then also the presentation, the recording of the presentation will be posted. So thanks, there's many thank yous coming in, but thank you so much to everyone. Thanks, Nigel. I think you really were able to get the message across, and as you heard from the various comments, yeah, it's widely supported, but also widely needed to see how we can reposition ourselves in this changing landscape, and given the priorities of both SDG 2 and SDG 3. So thank you very much, and thanks everyone for listening in and participating. Okay,
thank you.
Thank you. Bye-bye.
Bye.